vein and also in the IVC. If you see the echogenic mass in the renal vein and the IVC, you have to take it as the metastasis. Okay, so this is, you know that renal artery aneurysm, and I discussed renal artery and vein stenosis and blockage. Now I will discuss the sinus fibrolipomatosis. Can I do that?
You could, yeah, let me just finish this.
Okay.
You could
Oh.
erase the diagram.
Okay. Fibrolipomatosis. Where? In the sinus. Sinus fibrolipomatosis. That means kidney has a sinus. If you do the scanning of the kidney, so this is the right kidney, and you will see the kidney. I'm drawing with a different pen. So in the sinus area it is too bright. Sinus already brighter, and you see it's not only brighter, the renal cortex is getting thinner. Okay, so this is deposition of fat and connective fibrous tissue in the sinus. So as a result, the sinus will be more echogenic, and sinus is getting more echogenic and bigger, and the cortical area is getting thinner. You have to understand that cortical thinness is due to aging process. Due to aging process. Okay, if I'm getting 70 years, 80 years, my cortical thickness will be thinner. It is a normal for the old people. This is a normal aging process. But you need to understand that more you aging, couple of organs has more fat in it. One is the kidney sinus, another is pancreas. Okay, so pancreas. So this is sinus fibrolipomatosis. Then cortical atrophy. That is again more cortical atrophy means it is again aging process. Cortical atrophy. Cortical atrophy. Atrophy means shrinking, getting smaller. So if this is in the image, you feel like okay, kidney is also getting smaller, and the cortex is very thin, called cortical atrophy. Then this is sinus, the sinus. So this is also an aging process. This is also an aging process. It is not a disease.
It
It
can't happen to people that are younger?
No,
No.
no. That's why in the renal protocol, they measure the cortical thickness.
Mhm.
If you see 35 years old, but the cortical thickness is smaller. Say example, cortical thickness could be 0.7 centimeter
Mhm.
or 7 millimeter or 8 millimeter is supposed to be normal. Okay, and but in the 35 years old, the cortical thickness is less than 0.5 centimeter. Then you have to understand, at this age the cortical thickness should not be less than 5 millimeter. Then who can make this cortical thinness? You have to understand that maybe the cortex is not getting enough food and oxygen, and or there might be a cortical diseases. Then you have to check the renal artery. If the renal artery is blocked, so then kidney size gets smaller, so at the same time cortical thickness will be smaller too.
Mhm.
And if there's a chronic renal disease, higher blood pressure, uncontrolled high blood pressure, uncontrolled diabetes, so then it will cause the kidney shrinking. At the end, that kidney could be totally dry off. Okay, so this is cortical atrophy. It is also an aging process, and if you measure the cortical thickness, it will be less than 0.5 centimeters. Okay, so this is an aging process. You don't have to be worried about that. Now, solid masses. What are the solid masses you can see in the kidney? Solid masses in kidney. So first of all, we'll discuss about the say adenoma. Adenoma, it is a tumor arising from the glandular cells. This adenoma is a benign tumor, and this adenoma is seen in the cortical area. It is a benign, then cortical tumor, okay, and it could be hyperechoic, hypoechoic or isoechoic. Okay, you click the color, you will see the feeding artery. You will see the feeding artery supplying blood to the tumor. Okay, then you have to measure the length, height and width, and it has to be follow up the sizes. Okay, usually it is non-harmful, but you have to understand, is it blocking any artery or any collecting system? Okay, so that is adenoma. Now, angiomyolipoma. Angiomyolipoma. Angio means blood vessels, myo means muscles, lipo means fat. Okay, so angiomyolipoma means it is a tumor that contains the vessels, muscles and the fat. It is a deposition of this. So if this is a sinus, and this is cortex. If you see, there is an hyperechoic, well circumscribed mass in the cortex. So this is hyperechoic well circumscribed. And non-shadowing. Okay, you can be confused with the hemangioma because the hemangioma has the same style, and sometimes it could be isoechoic or hypo, very rarely, but most of the time it is hyperechoic. And where is the location? It is in the cortex. Okay, mostly it is in the cortex, and you can see it is in the medullary area at the junction of sinus and medullary area. Okay, you can see at the junction of sinus and medullary area. Okay, it is not seen in the sinus, and even though if it is in the sinus, you will not see it because the sinus is always hyperechoic, and the angiomyolipoma is again hyperechoic, so you're going to miss it. Okay, and it is a benign, it does not harm you, but it could be single, it could be multiple, and it can grow. Okay, you just need to follow up. So that's it. And non-shadowing, it does not produce shadow. So now there is another tumor called oncocytoma. It is a benign tumor. So oncocytoma, usually it arises from the WBC cells, like a basophil, eosinophil, like that, but it is, some textbook says it is one of the most common benign tumor. So, but unless it is biopsy, we don't know it. So that's why it is considered as a solid benign tumor. Okay, oncocytoma. And the renal calculi, that is important. Okay, so now we'll discuss so it would be number 4, and oncocytoma is number 3. Okay, so renal calculi. Calculi means stone, stones. Renal calculi is not rare, it is common. What do you mean by renal calculi? Stone in the kidney. Then where is the stone? Then you have to understand the renal anatomy. Okay, and this is cortex, and these are the medullary pyramids. Okay, so now stones has a composition. Mostly it is calcium. Calcium carbonate, calcium oxalate, calcium bicarbonate, and so many compositions are there for the calcium to be built. And why it is found in the kidney too? Because lot of waste product from the body is released by the kidney. So now, stones in the kidney can be developed in the cortical stone. There might be a stone in the cortex. And there might be a stone in the collecting system. A stone could be here blocking the major calyx. A stone could be like a staghorn stone, like a branch of a tree. So this is staghorn stone. Usually it forms at the pelvis and it extends towards the major calyx and minor calyx. Looks like branching out. That's why its name is staghorn. Staghorn is a animal, right? Animal has the horn, like a branching, like a deer, reindeer, like that. Now, understand that renal sinus, if the stone is in the renal sinus is brighter. Renal sinus is brighter. And if the stone is in the renal sinus, you can miss it unless there is posterior shadowing. Some stones does not produce shadow. Some stones does not produce shadow. It's just echogenic. And look, the renal sinus is echogenic. Collecting systems are echogenic. And there's a stone in the renal pelvis. It is also echogenic. So then you're going to miss it. Unless it produces shadow. Now, get the effect. If the stone obstructing the pelvis, outflow of the pelvis, then what would be the effect of this stone? If there's a stone over here, what would be the effect of this stone? Dilatations of the pelvis, major calyx, minor calyx. It leads to formation of hydronephrosis. If, look at here, if the stone is developing here, so only this minor calyx will be affected. There will be dilatations of this minor calyx. If you see individual minor calyx or individual major calyces are dilated. Look at here. This is a stone blocking this major calyx. So you will see dilatations of this minor calyx and this minor calyx will be dilated. The rest of the kidney will be fine. That's why you have to understand that hydronephrosis can be localized. Hydronephrosis could be all over. If hydronephrosis is all over, then obstruction is distal. If hydronephrosis is focal or local, the obstruction is close to the major calyx or minor calyx. So now, question. This is a stone. We call it cortical stone. This cortical stone is brighter. You cannot miss it. Why? Because the cortex is darker and the stone is brighter. You can see. You might miss the shadowing. I saw stones in the cortex, but shadow, you can miss it. But it is a stone, you can see it. But it could be confused with arcuate artery. Arcuate artery can have a strong reflection when it is at 90-degree incidence. Strong reflection is echogenic. So that could be confused with this echogenicity. Okay? So now, if you see the multiple echogenicities, and it is in the cortical area, then you have to understand this is calcified arcuate artery. This is calcified arcuate artery. Who has it? Elder patient. Elder patient, you will see calcified arcuate artery. Where is the arcuate artery? It is in the cortex. Now one more thing you might see called medullary calcinosis. What is that medullary calcinosis? The medulla of the kidney okay, there is medulla. Is another name, medullary calcinosis, another name is sponge kidney disease. Renal spongy disease. So now, this medullary calcinosis is deposition of calcium in the medulla. You scan the kidney, then you will see why the medullary pyramid, you know that it should be anechoic, but why it is hyperechoic? And not only one, two, all. Because the calcium, or they also said milk of calcium, they are deposited in the, it is a good news or bad news? Bad news, because all the collecting system, loop of Henle, are here. What does it mean? Means it is getting calcified. If it is get calcified, so then it will be obstructed, blocked. So as a result, what's going to happen? The urine will not come down. So as a result, the blood pressure, one day they will stop formation of the urine and the blood pressure is high. And the renal cortex will be brighter and the medulla will be brighter too. So known as medullary calcinosis or renal calcinosis or renal sponge disease. Okay, so due to deposition of calcium, they also call milk of calcium, in the medullary pyramid. Okay, you're going to get all this type of sono images in the board test. Okay, so you have to be ready for that. Okay, and staghorn stone, you will get this. Staghorn stone is formed in the pelvis and is branched out, and it is more common in those who have kidney infection with Proteus bacteria, Proteus, and it is more common in diabetic patient. Okay, staghorn. Okay, so now this is done. So now we'll discuss about the renal cell carcinoma called RCC. Can I?
Mm-hmm.
This is 5. Renal cell carcinoma. We call it RCC. Renal cell carcinoma are not rare. It is common carcinoma in the kidney. Usually it happens 4th decade or 5th decade. Okay, so that means 40 years to 50 years. Okay, it is common. And the renal cell carcinoma, usually it happens towards the cortex of the kidney. And let me draw. If this is the kidney, and this is sinus, and this is cortex. Cortex has its own echogenicity, which is darker than the sinus, right? Suddenly you saw that there is more darker and more concentrated area over here. Okay, you have to take it seriously. Then you have to scan in sagittal view, transverse view, then click the color. You will see it is hypervascular. You will see it is hypervascular. Sometimes because of this tumor, as it is in the cortex, so this area